Hello, everybody. Today's topic, I am going to cover obsessive compulsive disorders, even though I did it in the last video, but I won't spend that much time on it. Write this down if you're taking notes. As far as the AP exam goes, I've only seen OCD. I haven't seen these others, but it's fun. The AP exam is not the only thing in the world. Okay, hit pause and write this down. All right, so now the best way to learn about OCD is to watch this show, Obsessed, which is in a separate assignment. But if you're not in my class, then you need to look for the TV show. It's an A&E show, and they're all pretty much the same. And it goes through what is OCD and how to treat it. Now, in order to understand OCD, you need to understand the difference between an obsession and a compulsion, okay? Write this down if you're taking notes, okay? An obsession is when you can't stop thinking about something, okay? So you could be obsessed with a new boyfriend, or you could be obsessed with germs, or you could be obsessed with harming your family. I know that's strange, but imagine it's like you can't stop thinking about you doing harm to other people. Another phrase for obsession would be recurring unwanted thoughts. Like you just can't stop thinking about this. Even though you want to, you can't. That's an obsession. A compulsion is a behavior. All right, like hand washing would be a compulsion. Or every time I step on a crack, I tap my foot, 1, 2, 3, 4, and I count. That would be a compulsion. Okay, compulsions are unwanted behaviors, checking things like I had to check the stove 30 times before I go to bed. Or when I'm sitting there sleeping at night, I check my alarm clock literally 30 times. Okay, literally, I'm not exaggerating, okay? Check, check, check. Okay, that's a compulsion. Here's a good example of a compulsion. It's not really OCD related, but if you hear if your phone vibrates, I think most of us are going to check it. I don't care what we're doing. We're going to check our phone. We're like, ooh, why did my phone just vibrate? Or we got a notification of some kind. That is a compulsion. Okay. And when you combine these two, you get obsessive compulsive disorder. Okay. So again, on the left are obsessions, things that you think about, recurring unwanted thoughts. And on the right, you've got compulsions, behaviors. Okay, moving right along. All right, so look at this PET scan. What's going on here? Got a normal brain on the left and on the right. What part of the brain on the right, the OCD brain, has more activity? The frontal lobe or the prefrontal cortex. So if you're sitting there thinking, germs, 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 that's your frontal lobe doing its job a little too well. Okay? All right, write this down. So one explanation for obsessive compulsive type symptoms would be neurological. It could be problems with GABA, or it could be problems with serotonin. GABA is a neurotransmitter that chills you out. So if you take Xanax or if you drink alcohol, that will affect your GABA receptors. Okay? If you want anti-anxiety medication, but you can't get any from the doctor, it's not the best in the world, but it's something you can get on Amazon and buy GABA. It's really cheap. And if you take it at night, for me, it kicks in the next morning, but it doesn't kick in right then and there. It's not very strong or anything, and it's legal. Okay. Now, serotonin, when people have OCD or other OCD type disorders like hoarding, sometimes they will give them antidepressants that deal with serotonin. Some of you know them as SSRIs, like Prozac or Zoloft. Okay. All right. So just something to think about: serotonin, dopamine. Oxytocin is called the love hormone. It's what you get when you're petting a dog or an animal. It's what you get when you cuddle. It's the neurotransmitter that makes you want to pair bond. Like sit around and just clean the house with your girlfriend or your boyfriend. Maybe even to think about having a family in the future. Even though you may not want to do it right now, but you get these feelings though when you fall in love. That's oxytocin. Okay. So as you can see, love is potentially much stronger than, say, cocaine or antidepressants. Okay. Hoarding. There's a show called Hoarders on YouTube. Look it up. You watch 20 minutes of one, you've seen them all. But hoarders have an obsession with keeping things, and their compulsion is to never throw things away. Sometimes they dig in the garbage and they'll bring stuff home and they just won't throw things away. And so you get these people who, and unfortunately you have kids sometimes that have to live in these environments, and they're toxic. Some people are pet hoarders. They live on a farm and have like literally 50 cats and 20 dogs, and it's disgusting. It is absolutely disgusting. Okay. Trichotillomania. Trichotillomania is an obsessive compulsive type disorder where people pull their hair. Okay. And sometimes, so it's like an obsession. It's like you see a hair that's out of place and you want to yank it out. Some people will eat it and then have to get the hairballs surgically removed from their lower intestine. And Howie Mandel has OCD and trichotillomania. So what he did was he shaved his head because he didn't want to pull his hair. So instead of trying to stop the compulsion of pulling his hair, he just shaved his head rather than getting treated for it. Okay, I'm not ragging him on it. That was just a decision he made. Rather than treat himself, he just got rid of the problem, just shaved his head. He does have OCD in addition. They are related, obviously. Okay, this is not meth, but there are people who pick their skin obsessively. I can relate because when I feel a bump, I just want to dig in and just get rid of the bump. And I'm that way when I bite my nails. If my nails aren't perfectly smooth, I'll bite it. So I guess if you take that and to an extreme, make it skin picking, you have excoriation. Okay? Body dysmorphic disorder. I've heard it's called body dysmorphia, but I think it's body dysmorphic disorder. These people, when they look in the mirror, what they see in the mirror does not match reality. One day, Michael Jackson looked in the mirror and he said, I want to look like this. I want to dye my skin white. I want to get a lot of nose jobs. Okay. I want to, what's up with his eyebrows? Okay. And some people, they go to the plastic surgeon. They'll spend hundreds of thousands of dollars, and it's unreasonable. Okay. It's like an addiction to plastic surgery. Some people get out of hand with that. She thinks that that is reasonable, and it's not. It's just a backache, and then she'll never be able to wear clothes. Okay. And I assume this is right. It's just a meme I found. But if you look like that and you look in the mirror and say you're anorexic, that could be body dysmorphic disorder. Okay. She is not anorexic. Okay. And here's an extreme case. This guy spent all this money because he wanted to look like a Ken doll. All right. So it's like, what's wrong with you? Obviously, this is a mental illness of some kind. And then, just to show you how cuckoo he is, then he comes out as transgender. And I'm thinking, are you really transgender, or do you just want to look like a different doll? But that is body dysmorphic disorder. Okay. And another thing, when when anorexics look in the mirror and they think they're fat when they're not, that is also body dysmorphic disorder. Okay? How do you treat anxiety? Well, you could get cognitive behavioral therapy, or you could take anti-anxiety medication. Those are some of the ways to do it. Exercise and meditation also helps as well. Okay? All right, so people who habitually wash their hands numerous times before going to bed most likely have a what? Okay, the answer is, since this is a behavior, it's a compulsion. Hand washing is a compulsion. Okay, now if you're thinking phobia, maybe, but that's not the best answer. A phobia might lead to like more of like a panic attack or something. Carl has recurring unwanted thoughts. Let me repeat, has recurring unwanted thoughts of. And honestly, it doesn't even matter what comes next. Recurring unwanted thoughts, the answer is OCD, okay? All right, and it could be recurring unwanted thoughts of germs or harming his family, it doesn't matter. All right. Persistent, repetitive thoughts that cannot be controlled are known as what? Okay, thoughts. The answer is obsessions. Okay, obsessions are thoughts. Compulsions are behaviors. All right, look at your notes. Along with blank, abnormalities in neural circuits that use blank have recently been implicated in panic and obsessive compulsive disorders. Okay, so think about what neurotransmitters are involved in obsessive compulsive disorders and panic disorders, anxiety. The answer is, okay, GABA chills you out, serotonin stabilizes you as far as your anxiety goes and your obsessive thoughts. This is more of an anxiety disorder question. Okay. All right. All right, write this down if you're taking notes. So this is a classification: trauma and stressor-related disorders. Okay, so PTSD is one of them. And this is the only one I'm going to focus on. I just thought it was weird to have one disorder for a whole classification. I don't want to talk about this now, but it's basically people who were extremely neglected as babies, and now they can't accept love from anyone. Okay. PTSD, post-trauma. Okay. Post means after. So it's after the trauma. So think of a trauma, any trauma, or any trauma that you experienced or a trauma that you witnessed. Then you could have PTSD. If you're a soldier in war and you saw your best friend die, you might have PTSD. Or if you were shot at, or you saw a dead body, or you were assaulted, you might have PTSD. You might have been in a car crash or part of a terrorist attack. Then you might have PTSD. The symptoms are flashbacks, nightmares, maybe even panic attacks. Okay. So it could be war, it could be car crashes, and people have nightmares, flashbacks, and you can't just take an anti-anxiety medication to get rid of this. You need some sort of therapy. Okay. One form of therapy is virtual reality therapy.
Virtual warfare with a dummy rifle. Sergeant Robert Butler returned from Iraq with post-traumatic stress disorder, what was once called shell shock. But by repeatedly running this computer scenario, it enabled him to unlock and discuss troubling wartime experiences which had been buried away.
I'm a completely changed person. Am I 100% better? No, because post-traumatic stress disorder is always going to be a part of my life. Those memories are never going to go away. But it definitely has helped me to take steps and file that information. It does come up. It gets processed like every other memory. And I'm able to do the things, you know, a lot more now than I enjoyed before the war.
Many American and British troops suffer psychiatric problems after serving in the Middle East. Virtual Iraq is combined with extensive counselling. In trials, 30 out of 40 subjects were able to return to full duty.
Well, as we know, our different senses, smell and sight, are very powerful cues to our memory. And instead of allowing the person to continue to avoid these memories and have them continue to haunt them, if we bring them out into the daylight and really face them, we find we can really decrease the negative ramifications that they have on the individuals.
The smell of war comes from this machine, which releases the scent of burning rubber, Middle Eastern spices, even body odor. I went on a virtual armored patrol in Iraq. A turn of the head changes the view from the driver's seat.
This is quite an intense experience, and you can see how the sights, sounds, and even smells of warfare could help unlock some troubling memories for combat veterans.
The virtual Iraq...
One thing I want you to know, if you're picking on the game graphics, remember this isn't a video game. It was made specifically for that soldier. And what they do is they say, this is what happened on this day that gives me nightmares and flashbacks. And they create the scenario. And so when you look at the NPC behind him, the guy who was shot, that could have been his best friend. So it's very personal, okay? These virtual reality is very personal. But the point is to bring it out into the open. That's how you treat PTSD, with relaxation techniques, things like that. All right, so Jan displays anxiety, irritability, inability to concentrate, and apathy. That means she just doesn't care either way. She also re-experiences a disastrous event through nightmares and vivid memories. All right, so what's Jan experiencing? The answer is PTSD. Okay? All right, dissociative disorders. Okay, write this down if you're taking notes. So think of the word associate. So when I want to hang out with the band kids, I associate with them. But let's say I don't want to hang out with the band kids anymore. I would do the opposite. I would disassociate myself with them. So it's like pulling away, dissociate. Associate is when you go to it. Dissociate is when you pull away. So imagine this. You suffer a trauma, and it's pretty bad, okay? What you could do is say, that trauma did not happen to me. That trauma happened to one of my other personalities, another one of my multiple personalities. We call it dissociative identity disorder. So if you suffer a trauma, then you could say, that didn't happen to me. That happened to Mary, my other personality. And it's a way to protect yourself from trauma. And that's why we get what used to be called multiple personality disorder. Dissociative amnesia is just like when we talked about repression. You press the memory down into the unconscious. But in modern day, we call it dissociative amnesia. It's when you forget the trauma, but it's not caused by brain damage. It's caused by psychological trauma. So if you hit your head really hard and you forget, that's not dissociative amnesia. That's something else. So if you were assaulted or you witness a murder and you don't remember it, we call it dissociative amnesia. Now, same thing if a trauma happens, but then you leave and you go on a journey of some kind, that's called dissociative amnesia with fugue. When you see the word fugue, think of the word fugitive. Okay? So imagine like you're in a terrorist attack or a big accident, and then you get up and you walk away, and then they find you in a hospital 2 weeks later, and you don't know what your name is, and you don't remember the trauma, that's called dissociative amnesia with fugue. Now, if you stay put, there's no fugue. It's just dissociative amnesia. Okay? So DID is what it's called, dissociative identity disorder, multiple personalities, DID. The stuff of soap operas, we've all seen, certain shows where people have multiple personalities. It's called DID. Okay? Dissociative amnesia is when you forget the trauma. And dissociative amnesia with fugue is when you leave and you go on a journey of some kind. It is rare, but some people will take on a new identity, and you'll find them sweeping floors in a truck stop in Kansas or something. That's rare, though. That's the stuff of soap operas. And in early season 2 of Breaking Bad, Walter White faked a fugue state because Tuco kidnapped him, and he wanted to make sure that he had a reason why he disappeared for about a week. Okay. All right. Following the failure of his business, Dan disappeared and was discovered 2 years later in another state, practicing dentistry without a license. When questioned, he responded that he had found himself in a strange city and could not remember any personal information. All right, so he left. He left the scene. So the answer is he forgot and he left the scene. So that's dissociative amnesia with fugue. B, it would be B if he had multiple personalities. But Dan stays Dan. If Dan became Charles, then it might be B. Okay? All right, now, for the counseling department, I just wanted to make you aware of there's been a lice outbreak in the school. So be on the lookout. This is what it looks like. Make sure you know the difference between dandruff and lice and eggs. If you get up really close, this is what lice looks like, and this is the eggs, okay, that look like. So be on the lookout. If you do get lice, you need to get a specific kind of comb to comb it out of your hair. Okay, so just be on the lookout for that. Okay. And sometimes lice can get in your eyelashes. Okay, so just be aware of that. All right, write this down. Okay, just so you know, I have seen these 3 on the AP exam before. So anyway, all right, so here is a new category of mental disorders. It's called somatic symptom and related disorders. I want you to know that anytime you see the word soma, that means body. I've even seen some cell diagrams where the cell body is called soma, okay? It means body. And in the brain, remember the sensory cortex? It's also called the somatosensory cortex. All right, so I want to tell you about 4 disorders. You've got somatic symptom disorder, and this is when the mind creates bodily symptoms. So I want you to imagine this. You're on an airplane, and you find out that somebody on that plane has Ebola. And you start freaking out. Oh my God. And then you start feeling symptoms. You might get feverish. Your back starts to hurt. You might even cough a little bit. And you know what? You don't even know the symptoms of Ebola, yet you're starting to have these imagined symptoms. Okay, imagine if I told you that the person sitting in your chair threw up just an hour ago, and you might start feeling stomach aches and stuff, and you might start feeling a little dizzy. That's now, if you take that to a much more extreme, that's somatic symptom disorder, okay? All right, hit pause if you're taking notes, but but anyway, I'm moving on. So somatic symptom disorder is when people, they're not faking it, but their symptoms are real to them, but they're feeling symptoms of a disorder that they don't even have. These people tend to be very histrionic and dramatic. And yes, they do it for attention, but they may actually feel symptoms. They're not faking it necessarily, but they are certainly getting, their symptoms are a little bit more exaggerated than normal. Okay? There are some women who get so obsessed with getting pregnant that they actually start to feel symptoms, and they might even have cramps, and sometimes their belly might even start sticking out a little bit, and their nipples might get sore, things like that, and they might get morning sickness because they are so obsessed with getting pregnant. So that would be a form of somatic symptom disorder. Conversion disorder. When a part of your body stops working because of stress, we call that conversion disorder. Imagine a soldier who's scared in battle and then their eyes stop working. They go blind because they're scared. That would be an example of conversion disorder. But there's nothing wrong with your eyes, but you go blind anyway. That's called conversion disorder. Or what if your legs stop working? But there's nothing wrong with your legs. That's called conversion disorder. Okay? All right. So I want to show you this film. Now, what I'm trying to show you is an example of somatic symptom disorder, but they call it conversion disorder, but this was in 2012. The DSM-5 says that conversion disorder is when a part of your body stops working. What they're really talking about is somatic symptom disorder. There were these teenage girls in a city called Leroy who started to have symptoms of a non-existent disease. And nobody knew what the disorder was, but it actually started to spread, and people thought it was environmental. But it turns out we think it was all in their head.
Spasms afflicting a dozen girls in Genesee County. A doctor treating most of the victims has received permission from one patient's family to reveal her diagnosis. News 4's Jackie Walker has the story now.
Dr. Jennifer McVig of the Dent Neurologic Institute says the patient she has permission to talk about is diagnosed with conversion disorder.
No.
It's a psychological condition where a person manifests physical symptoms of an illness, such as seizures, headaches, uncontrollable shaking, or tics. Dr. McVig, who is treating 11 of the 12 patients in this case, says victims do not do this purposely, rather subconsciously.
What you find mostly is that individuals who have manifested this disorder have a great deal of stress, or there was a stressor in their life or a stressful moment in their life, which it's kind of like the straw that broke the camel's back.
It's still not known why nearly all 12 Leroy High School girls began showing symptoms 9 months ago at about the same time. 2 of those girls appeared on NBC's Today Show Tuesday morning. Thera Sanchez, who is not a patient of Dr. McVig, says she's frustrated because she believes doctors are not getting to the bottom of this.
See the tics?
I want an answer, a straight answer. I've had psychological treatment. They say this is stress-induced. This is my psychological treatment. That's all they do is stress me out more.
There have been multiple studies performed, imaging, laboratory studies. There's nothing that makes me believe that this is related to anything infectious, any drug-related issues.
Jackie Walker for the 10 o'clock news.
Dr. McVig.
So now that somatic symptom disorder, so basically they're saying it's in their head. And I know it's frustrating when you have it for doctors to say you don't have a real disorder, it's purely psychological. And I know that's very frustrating. But they have found nothing wrong with those girls, okay? And what's interesting is that you know it's the girls, all their friends got it. Everyone thought it might have been environmental, but they found nothing. that would cause the symptoms that they had. So again, they're not faking it, but it's in their head, okay? And conversion disorder is when a part of your body stops working, like your eyes or your legs, like, you just can't walk, okay? All right, so which of the following types of disorders is characterized by complaints of bodily symptoms that do not have a detectable medical cause, but rather are caused by psychological factors? Now, this is a classification, and the answer is somatic symptom disorder. Anyway, all right. Now, in the same category, you have what we used to call hypochondria. Now, these people they're not faking it, but what happens is that they freak out over very small things. Like, for example, they might get a little cough, and then they're like, oh my God, I've got some rare tropical disease, even though I've never been to the tropics. And they start reading about stuff, and then it makes the symptoms worse. And then they go to the doctor, and they think they're experts, and the doctor's like, get off the internet. And the internet has made this disorder worse. People used to go to the library and get books. Now they just get on WebMD, and then they self-diagnose, and then they like to go to the doctor like every 2 or 3 weeks. And we call it hypochondria, but we now call it illness anxiety disorder. And they take these little symptoms and say, oh my God, I'm going to die of Ebola, and they manage to convince doctors to give them all kinds of medicine that they don't need. Okay? Okay. So an individual diagnosed as having a conversion disorder would be most likely to show what? Okay, look at your notes. Conversion disorder. The answer is, it's when a part of your body, such as your legs or your eyes, stop working, even though there's nothing wrong with the biology. Craig is sure something is wrong with him, even though his doctor has not found any physiological basis for his complaints. He returns to the doctor every few weeks to report symptoms of new illnesses based on information he reads. All right, so Craig obviously has illness anxiety disorder, but this is a classification question. So what classification is it? The answer is somatic symptom and other related disorders. That's the name of the classification. Kara witnessed a violent burglary. Shortly after the event, she was unable to see. Doctors could not find anything wrong with her eyes. Kara is most likely experiencing what? The answer is conversion disorder. So imagine a soldier seeing something so traumatic that his eyes stop working to protect him, really. Which of the following psychological disorders is correctly paired with the appropriate classification? So this is another classification question. All right, the answer is PTSD is a trauma and stressor-related disorder. Okay. All right, I have never seen these on the AP exam, but I'm going to talk to you about them anyway. These are feeding and eating disorders. Okay. And so from what I understand, anorexia, which is about 95% women, it involves calorie restrictions. These people, they starve themselves to below 85% of their minimum body weight. So basically, some of them look like Holocaust victims. Okay, I'm not trying to be funny, okay? I'm just trying to get you to understand. When it's 110 degrees out in the summer, you'll see some women walking around like this because they're trying to burn off extra calories and stuff. And then they just won't eat. They'll sit there and they'll play with their food, and then they might spit it into a napkin and then sneak off to the bathroom and flush their food. That's anorexic, okay? Or they'll have these rules about not eating, okay? Like, oh, I don't eat this. Oh, I don't eat that. And they're ridiculous rules. Bulimia, people with bulimia are not necessarily skinny. They are, but they're not as skinny. Some of them are actually a little chunky. But the point is what bulimics do is they will binge, eat massive amounts of food, and then go purge it, meaning they go throw it up. So instead of just never eating at all, they will eat like an entire large pizza by themselves, then go throw it up, and then go eat a large cake, and then go throw it up. They binge, and then they purge. Some of them use laxatives to like make it go out the other way. Okay? And both can suffer from body dysmorphia or body dysmorphic disorder. What they see in the mirror does not match reality. Binge eating disorder, it's when people eat massive amounts of food at least twice a week, but they don't throw up. They don't purge. They just get fat. Okay? All right. So as you know from that any kind of disorder, there's genetics, there's psychological, there's environment. It all comes together. And this is true pretty much of all mental disorders. There's nature and there's nurture. Okay? Now, you saw a little bit of anorexia in the intervention twins video, but that wasn't typical. Most anorexics, from what I've heard, have hyper over-controlling parents, and they tend to be wealthy. Now that's not 100% true, but if you want to learn more about eating disorders, watch this movie on Netflix. It's called To the Bone. It's really good. And it stars actors who have suffered from eating disorders in the past. Okay? It's called To the Bone. Okay? All right, that's enough for today.